Hi friends, today our topic is the postpartum hemorrhage. So what is postpartum hemorrhage? The postpartum hemorrhage generally means there is the bleeding occurs after giving birth to the baby. So it is the type of obstructive emergency. So it is also termed as the blood loss of more than 500 ml following the vaginal delivery or more than 1000 ml following the cesarean delivery. Uh, then the postpartum hemorrhage is further divided into two parts, that is the primary postpartum hemorrhage and the secondary postpartum hemorrhage. So the primary postpartum hemorrhage means the loss of this amount of blood within 24 hours of delivery, and the secondary postpartum hemorrhage means the bleeding after 24 hours of delivery up to 6 weeks. Now we will focus on the main causes of postpartum hemorrhage. So the first cause is tone, second one is trauma, third one is tissue, and fourth one is thrombosis. Now we will look on to the first cause of postpartum hemorrhage, that is the tone. So lack of uterine tone, that is the uterine atony, it is the first cause. So what is atony? Uterine atony. So uterus fails to contract after the birth, leads to excessive bleeding. So immediately after the birth, the uterus has to contract. So to stop the bleeding which occurs during the labor. But in this case, uterus fails to contract because of their lack of tone. So why it is occurs? So it is occurred because of the multiple pregnancy, the muscle fatigue, and if the mother is having the full bladder. So what are the uh, treatment for this? So first one is the mother should urinate, so we should place the catheter in the uterus. The second one is the fundal massage. The third one is the medications, different medications for that, and the last one is the surgery. So this was the first cause of the postpartum hemorrhage. So now we will focus on the second cause of postpartum hemorrhage, that is the trauma. So damage to the genital structure such as uterus, cervix, vagina and perineum. So cause for this is incision from the C-section, baby coming from the vaginal wall, canal, from the medical instruments. So medical instruments include such as vacuum delivery, forceps delivery or the episiotomy. So the treatment for this is applying stitches to the affected part or the cut part or the surgery. These are the second causes of the postpartum hemorrhage. Now we will focus on the third part or the third cause of the postpartum hemorrhage, that is the tissue. So in this, placental fragments retain in the uterine cavity. So because of the retained parts of the placenta, which is also called as placenta accreta, the postpartum hemorrhage occurs. How it is occurs? The retained placenta prevents contraction and which leads to the atony. So suppose this is the uterus, and there is a part of the placenta remains inside the uterus. So uterus fails to contract and which leads to the uterine atony. So this is also the important cause of the postpartum hemorrhage. Now we will focus on the fourth cause of the postpartum hemorrhage, that is thrombosis. So the mother having blood clotting condition such as genetic, if she has having von Willebrand disease, this is one of the cause. This is one of the condition for that, and obstetric, that is the eclampsia and placenta abruption, which can be lead to the condition known as DIC, disseminated intravascular coagulopathy. So these all can lead to or can prevent the clot formation. So because of the clot formation, which prevents the clot formation, so the bleeding does not stop, and it is one of the most important causes of the postpartum hemorrhage. So now we will focus on the management portion of the postpartum hemorrhage. So postpartum hemorrhage, as we discussed, it is an obstetric emergency. So what is the role of nurses in that? So we have to monitor the vitals. As a mother is losing her blood, so we have to replace her blood till the blood product is ready. So we have to first give the IV fluids, as she is less fluid, as she must be having the less fluid in her body. So we will give her IV fluids. Then after arranging the blood products, we should give the blood to the mother, and we should prevent her from the shock. So this is the small part of the management portion. Thank you. Hope you like this video.